So you're asking the questions, or I left a few questions on the whiteboard that we might start with. But if there are questions from the audience that would like to start, or from the panelists, maybe we'll start with that. Yes, please, David.
Hi, I'm Inon Schenker. I'm from Teva, and I am actually heading at Teva two very different managers. Two different projects.
Would you like to come here and speak with the microphone?
I'll speak louder.
They won't hear you at the online, so it's.
So basically, technology. Okay, thank you. Inon Schenker from Teva. I manage global public health at Teva, which is a very new position, and at the same time also had started to act on the premises of what Dr. Yardeni was saying just before on the collaboration between academy and Teva. So we are working on a new project which is called Teva Academic Global Relationships. And in this room are several of the recipients of the NNE, which is our National Network of Excellence in the Neuroscience. And that's just the background. What I'm trying to ask the panel and relate to a few of the things that you've said is actually around 4 words: money, power, responsibility, and time. So when Dr. Nimrodi was saying, let's be more equal, if Tel Aviv University will be ready to share the risk of $1.2 to $2 billion it takes a company to develop a drug, and would say, well, c'est la vie, it didn't work, we've lost the money, that's being equal. Because when a professor has PhD students and his postdocs, there is no lose there. They'll get their PhD and he'll get another advancement in science, which is very important. So that's an issue around the quality. Another point is, of course, on the responsibility. And I would like to put my global health hat here. What pushes more? The academic interest in the funding, so I connect responsibility and money in this case. So actually scientists would target their research or move their research to where money is available, because there are other sources that are diminishing and the private sector is providing huge amounts of potential funding. So that's another question. What drives the research agenda and who is responsible? Thirdly, and with that I'll last, because I don't want to, of course, take too much time, is the issue of responsibility in terms of also the internal dialogue necessary within the academic world. My profession is public health, and I know that had we not been able to be successful in actually having a drug to reduce mother-to-child transmission of HIV, we would have had in the world today about 7 million children suffering from AIDS. The fact that there was a success in the prevention actually deprived enormous efforts all around the world to find the right treatment for the 0 to 5-year-olds suffering from AIDS. So today, for example, there is no treatment for children living with AIDS because there is no interest on the side of industry to actually develop such a treatment. The number of children suffering is not. So the collaboration is also within the academic world in actually having the prevention treatment dialogue, and I'll rest with that. Thank you.
I guess I need to respond to that. I'll start with the positive. I mean, indeed, Teva initiated the NNE program, and I think Tel Aviv, correct me if I'm wrong, Uri, was #1 in terms of the awards.
Of the awards came to
so that certainly indicates, as far as the level of science and the relevancy of what our scientists are actually doing in these institutions. So with all due respect to what you've said, and maybe I need to clarify, of course I'm not comparing the role of academic in mankind and the role of industry is different. I never for a moment, and if that's what you may have heard from me, I'm here to clarify. I'm not expecting to be equally compensated, not anywhere close. But to my regret is that to have an approach where industry comes and says, okay, you know what, we're going to give you a few $100,000, we're going to give you $500,000, and guess what? Whatever you're going to generate is going to be, and I know Teva is not doing it, okay, so, but some industries do. Whatever you're going to develop is going to be mine. That's a big problem. And because that means that all of a sudden we became a cheap R&D labor for academics. And it's a slippery slope from there. I'm sorry? For industry, you're right. And this is a slippery slope from there, and I think we're living at a time that we can't waste time. I mean, maybe Teva has a huge pipeline of drugs and they don't need to collaborate with industry, which I know it's not the case, but if I will judge by the number of pharma companies that are coming here to Tel Aviv, there is no week that goes by that we don't have a multinational company that comes here with the highest level executives to actually look for early stage innovations. It's a numbers game. How many molecules do you have to actually float in order to get one of them successful? You tell me, thousands, right? So I think academic needs to be incentivized, needs to be encouraged, needs to be welcomed, and I think the business models that academic actually expects today, in my opinion, is very modest. You know, getting few percentage on successful drugs, I don't think that's too much of a price to ask if indeed we're a contributor to a drug that changed people's life. So I hope that clarifies my statement earlier.
I just want to say something regarding the academia and the role of academia in drug development as well. I think there is a place for improvement, on the other hand, of the sensitivity of the academia to timelines, for example, to kind of an overall need in the industry when you actually develop a drug. And in a lot of places, and I have definitely can tell that I run research on Teva compound in all over the world's academia, it's not actually always work. So academia people have their own rhythm in life, and on one hand, they seek to you, they want to collaborate with you. It brings them, some new aspects, to them and to the students, some exposures to the clinical world as well. But on the other hand, they're not so much, I have to say, aware of our stress timelines. Patent issue that you actually described is very actually not on our behalf as time is going by. So we need the information much faster. We need the collaboration faster. We need some good ear to our needs as well.
I think it's a very good comment, and Liat is absolutely right. I mean, one of my struggle is, or one of my, I would say, realization is that I can't really cater or work with every scientist in the university. I really have to work with those that wants to make a difference. And a professor like Danny often does have the understanding and the responsibility, but the only way this is going to happen and going to increase is if the industry will embrace academic and will actually see them as a potential ally to increase their own successful outcomes. And I think the more collaboration we have, the more PhDs, the more postdocs, the more sponsored research, the more people you're going to get that actually understand what industry needs and will more likely give you something you need.
May I add two more things? I think first, we are starting to in a way to change the way student thinks by giving education on the other side of the fence, and I think the way that we speak here, this is the first thing, and I think one of the things that bother me is that we are still you are saying they and we, and I'm saying you, and so I think we are still not speaking on the same language, and I think what we should do, and we are not going to change the academy. The academy is going to continue to create knowledge and papers, but I think that in each university, and this is at least my vision, there should be some kind of innovation center or accelerator that will take this applicative project, bring them to the next step with the industry, and work together. So if you have it active in a specific area or specific direction, it will, I think, it will act like a sink, and more people will go there and will want to do it. So it will change, I think, in a way the way universities are organized, and they are going to discuss it later on. And this is a process that I think we need to start, but it's on the way there. Let's Michal, and then.
I just want to add the perspective of IT company and the ability of research in academia to impact society. I think has to do beyond development of drugs, if I may say. And I think that the two examples that were provided earlier on was one about HIV mother-to-child, elimination of HIV mother-to-child transmission, and the other one was about schizophrenia. Both resonate well with efforts at IBM that I think might open the door for innovation in different directions. I'd like to mention very quickly how we work with academia on that. We work with the president of Ghana and with two professors from Yale Medical School on trying to eliminate mother-to-child HIV transmission, where of course there are drugs, but there are other barriers to getting preventing women from delivering kids with AIDS. And these barriers has to do with the ability to reach out to these women and the question of how to monitor the population, how to learn who suffers from HIV, and to get to these villages and areas and provide the care needed requires leadership from both university and IT company who has innovation within it, and IBM as an example. And that's one effort that we launched this year, and the President of Ghana talked about it. Another example is schizophrenia, and again, this is previous year in US, and as you know, the US system for addressing massive depression and schizophrenia does not function and doesn't work well. The system is broken. There is no coordination between entities. And there was a pharma company called Otsuka, sorry for mentioning someone else apart from Teva, but there was some pharma company that realized that they lose their patients because if patients work at some place and have health insurance, while they have some inflammation or some problem or hallucinations, they start to suffer from the schizophrenia episode that they have. They stop work. They don't have health insurance. They have nobody who treats them. They get to the streets, and from a pharma company perspective, they lose patients. They don't treat them. And in order to get back the patients treated, they coordinated between IBM and University of Florida. In Miami, there are many schizophrenic patients, where we try to find a way how to coordinate between the authorities who address schizophrenic patients, between jail system, between the psychologists, the health insurance, and many other entities. So that's just to open the door to other directions where universities can impact the world in bringing better solutions for people suffering from neuro diseases.
People will hear you, I think. Go ahead.
Yes. I just had language, as Uri said, I think is very important, and I have perceived a number of miscommunications between academia and industry. I might have misperceived myself, but I just want to bring it up. Two statements. The first one, there are two examples. Dr. Hayardini brought up this example of how one mechanism of action, many drugs, they still make money, pay attention to that. The message that students receive, or that I receive, is mixed. One message, and I'm not sure which one was the intention, one message that I perceived is, you know what? Just reproduce, repeat, modify slightly drugs, same mechanism of action, will still make money, that's success. That's, in my mind, really contradictory to the basic mission of academia, which is have original ideas, learn, and it's scary. Now, I understand and to some extent respect the quest to feed the beast, make money, and maybe even make better drugs by modifying delivery of molecules. But it's a slippery slope, and communication is essential because Because misunderstanding, and of course, the other intended message, I don't know which one was, no, don't focus that much, focus on innovation. You have to be clear about these mechanisms of how industry makes money, that's true, but maybe the place to do those modifications is not academia, it is industry.
So let me just get this actually quite straight. So my role today was actually just explain why is science important. And I'm not giving any directions, any order, anything to any of the scientists to invest whatever he wants. The only thing that I was actually hoping is actually teeping. If you want to go to the industry with kind of a pack and say to them, listen, this is what I think, this is what I found, you just might know what is it actually doing. So that when you're actually presenting this to the industry, you just want to know and let the industry have kind of a presumed of what you invested. It's not our role at all, I have to say, to direct, instruct, nothing, the academia of what are they investigating. That's really about all. From our point of view in the industry, if you want to have a very good pipeline, you probably, and I'm not responsible in Teva for the pipeline, but you might want to have some of a lot, okay? But it's going to be very beneficial to us if you come to me so that you will know what do you have in your hands. It will help me a lot to actually make a decision better, and that's about it, I have to say.
Well, that message is clear, and I think it's ABC.
I just wondered, isn't there some kind of give and take? So what I understand is that industry is interested in good results and insights into science, but is there as well like something you could give back? Like you need the results, you need the knowledge
Repeat the question.
to develop good drugs.
So you're actually asking, like, it's a kind of a give and take. You want science from us, and what can you actually give? All I can tell you is my private, I have to say, experience. I can definitely tell you that in Jerusalem Medical School, for example, they actually established a very nice course that actually was in all the last year, bringing all the people from the industry of the pharma, giving talks about their expertise. So I actually definitely can tell you that I have 2 lectures there. I gave the opening talk, and then I gave another talk. And from our point of view, bring me to your lab. I will do it for free. Show me some results. All I can tell you is that I will be more than happy to share with you all my experience. I'm just working in the industry for 14 years. I'll be more than happy to do it. You know, when they called me, they were asking me to come there and give a talk. I actually did it. Put it in your syllabus. Give people from the industry in your syllabus, every one of them. I'm sure that every one of them will give you 1 tip or 2 from his own experience and from own point of view. Just do it. Ask for it. You're going to get it.
This is the second point I wanted to make, because I had 2 points. The second miscommunication example that I have is this equal footing question that Shlomo brought up, and felt a little bit of tension, which is nice in debates. But you talked about the timeline that is necessary, that industry expects in moving forward. And you said that you don't understand why. It's because it's not equal footing. Because you expect a postdoc to follow an industrial timeline. In industry, I think, I've never worked with industry, probably that shows. In industry, you have staffs helping you to move forward the project. It's not one person who also has other obligations, academic obligation to meet a certain timeline. So maybe industry needs to give a little bit more resources and not just presentations and talk. That's equal footing. I think there's a miscommunication.
Yeah.
That's my perception.
A couple of things I'd like to add. I mean, first of all, let's not forget that some of the most successful drugs in the world came from academic institutions, okay, including Teva's Copaxone, which is accounting today for what, more than 50% of the bottom line?
You don't want to know the numbers.
Okay, it's probably more than that. Okay, so it's a very high number. So let's not forget that. And there is a win-win. I mean, YEDA, Weizmann Institute, and everybody is happy, okay? There are different models of giving back, and that's, I guess, was one of my message to you. I think that working with industry, especially in areas of CNS, where the endpoints are challenging, behavioral, which is not as objective as you would like it to be. I think working with industry early on is important. There are multiple programs that we're deploying here at Tel Aviv University. I mean, there is the NNE example that was given here from Teva. We do this almost every month. We have another deal with another industry to do a sponsored research. And in fact, this is the way we prefer to start collaboration. We recently actually announced a unique initiative, which to the best of my knowledge, I haven't seen it elsewhere. We announced a fund, $20 million in size, that would enable investment in promising innovations and bring them to a point where it's a material asset to a pharma company or a high-tech company, or it's really not geared toward drugs only. It's very diversified. And when we actually structured that fund, it was very important for us to bring an industry player as a partner to anchor the fund. And lucky for us, happily for us, we managed to attract Tata. Tata, the Indian conglomerate, I mean, $100 billion company with vision to become $500 billion company in 10 years. We actually managed to convince them that teaming up with Tel Aviv University, being a very diversified interdisciplinary institution, which is, by the way, key in CNS, was a key driver for them to actually make a commitment, and they have actually taken 25% from the fund to invest themselves. I mean, that's what really opened up the gate to bring others. In the process of them getting comfortable, they came here. They brought 13 CTOs, PhDs in different areas. I mean, they met with more than 70 scientists across the university, I mean, in every area, in software, in engineering, in medical devices, in medicine. And after analyzing the science, they concluded that this is a good investment for them to make and a gateway to a lot of opportunities. Some may be successful, some may not. But, you know, if the odds are 10% successful, 5% successful, this could be a blockbuster. Now, in order to make it successful, we had to guard for several things. We have taken the decisions on the investment from the university. The university is not making a decision what is a good product or a good investment to make. We actually gave it to industry experts. We also hired people that have developed drugs, and if we're talking about drugs today or pharma products, that know what industry is looking for, and that is as an attempt, I would say, to really bridge that gap that we're talking here about.
Another few words about the interaction between academia and industry. You're not waking up in the morning and say, okay, today I will have a patent. I'll discover something. It's a surprise. So we have two surprises. First, that it works. As you know, as a scientist, that I don't say how many % of our experiments are working. And the second surprise is nobody did it before, which means that it might be a pattern. Now, to get this surprise, we have to try many directions, many experiments, a lot of work. Now, we meet with the industry after this surprise. So this is the end of the process. Now, we want the industry to support or to have some collaboration. Who support all the attempts before that didn't succeed? This is the financial support. Now, there is an expertise that the industry should bring us. Because when we come with this discovery, they say, okay, why didn't you check the PK, PD, whatever names that we don't know about it? Now, please repeat all the experiment. But if we met a few years before, and you saw the data, and you were working together, you can educate us what will be good for the industry, so we can save several years. So I think the communication should be in early stage, not based on succeed, but based on the attempt.
I think you're asking for a lot, as you probably actually quite laughing by yourself. I mean, it's you cannot actually expect. There's one thing that I can definitely tell you is that once you got a nice patent, it's actually your role to ask for somebody that is paying for your patent that will pay you for all the attempt and all your future attempts for actually discovering, why you probably don't understand what I'm saying because you look like so surprised. What I'm saying is, what I'm saying is, it's, we develop a lot of drugs, okay? Who is going to pay for all these that fails in preclinical toxicology, phase 1, phase 2, and sometimes phase 3? We're talking about billions of dollars. Who's going to pay for it? The drug that actually made it to a place. Same for you. And as I said before, you can actually consult any people from the academia once ongoing. From the industry, sorry. Go ahead.
I think I happen to agree with Liat here. I don't think it's a question of money, because Tel Aviv invests more than $150 million in R&D. It's not as much as Harvard, of course. Harvard has an endowment of multi-billion probably, but it's really the guidance. And I think if we actually hook up with industry early on, and we understand what is the unmet need, what are they looking for. And if we care to cater for these needs, I think we shorten the process substantially. Funding, there are solutions. You know that, Danny.
Tell me more.
Let me switch from money point of view to student point of view, and I would like to raise one question maybe before we finish is, what advice would you give a student or researcher that would like to combine industry and academy together?
Because I think it combines, and I'm happy that we are moving, because I wanted to move also from this very technical discussion and industry to what we have here, education and students, but combined, because Liat, you mentioned earlier the barriers, some of the barriers in time and misfed, and just we just heard from Mr. Nimrodi, regarding the human part, like that we have to collaborate. And I want to combine both of them and to relate to the first panel as well. And it's all one, because if we need, and that's what we have to do, to sit together, industry and the developers in the university and the researchers and the PhD students together, we need a platform to do that, and they are. And it's not only guidance. We need to collaborate to understand the needs of the industry, to see the privilege. We need a common language. But we have barriers. The barriers are publication, the barriers are IP, and others. Wait, I know. So the question is, and this is going towards that. We have collaboration already in various areas in the university, tools and a concept. We will need another layer of converging between the industry and the academia, and in order to do that, and it's going there, the AAA has decided about that already, that they are going to shorten tremendously and to change the way of peer review. They are going to fasten the IP, and what you said right now. That's what we need to do all together. And in order to do that, we need to impact that, to bring you and others into the academia, to involve it in the education system, and to try to build this, common discussion.
Definitely, I can tell you, I worked in Teva for 14 years, okay? Never, up until today, I have to say, because I'm running to another lecture from another Dan David or something, building or something, hopefully with the ways I'll be able to get there. Thank you for developing this. Never, actually, and I gave talks in places that I never knew that exists, okay? I think somebody ever, actually called me to talk in Ma'alot, which I was not even sure where am I going, so I took a train in order to get there and to be sure where I am. Okay, never I have, seen any person from Teva, from at least drug development, because this is where I work in R&D, was asking to give a talk, to be part of a discussion, to consult. And CDA is, you do it like this, and then any one of us will sit with you. We sit with any company. They're showing us the data.
I think it was not a complaint.
Just one more remark to comply that. Regarding the first panel, I think the information today, and given IBM and other companies, could be, as you presented, like I have a drugs and there is a publication here for, there is another publication against, there is a fourth one. So the technology will provide the direct access, the direct combination, the direct evaluation very soon regarding this. And then what I said, communication. Communication is not only sitting together. Communication is making visible, and therefore I talked about the peer review, and therefore I talked about the IP. The really being exposure, evaluated, and responsible publications that could provide your knowledge, the academia success, and the common language discussion.
So we should end up and maybe with one advice for the student. So how to combine the things together? Danny, maybe from your experience?
What I said to my students, there's no applied science or basic science. There's good science and bad science. So you have to do good science and all the rest will be okay.
That's a good one.
One thing, we're talking about industry. We're missing a very big component, hospitals. There are 17 hospitals that Tel Aviv University is affiliated with. There is nothing like working with an MD who really in the trenches and with the sick people and understand things. With all due respect to industry, I think collaborating with hospital is a very important initiative which I'd like to be part of the Brain Boost effort as well. Uri.
I think that probably Nir will bring it at the last session today. That one of the things that we are trying to create is
the last session,
fourth session will be education in neuroscience, and we are trying to build also a pathway or a program for that. So I really would like to thank all the panelists and the audience for their time.